I am going to use Gibbs reflective cycle to reflect on my learning. At the start of the module, the facilitator introduced the inquiry-based module to us. We were divided into 8 groups, exchanged the contact, and created a WhatsApp group. We created ground rules, and we had a case study, and each case study required interventions or a care plan. So as a group, we collaboratively brainstormed and participated in decision making to develop the care plan or the intervention. My role in Ellen's best interest meeting as a social worker was to work collaboratively with Ellen, the MDT, and their sister. I helped Ellen and facilitated to get the Section 117 aftercare because Ellen was detained in hospital under Section 3 of the Mental Health Act. On top of the NHS Section 117, Ellen was also entitled to NHS Continuing of Care funding and other interventions that Ellen is entitled to. I also helped Ellen to apply for a mobility car since Ellen is a Catholic and would love to go to church. Ellen agreed to go home for 2 days and then be discharged after 2 weeks. So we had a plan in place and all healthcare professionals were aware of their roles. We used the Roper, Logan, and Cheney model to assess Ellen's needs, and some professionals were able to focus on certain aspects of daily living that Ellen needed assistance with. My confidence of decision making towards multidisciplinary meeting increased, and I gained awareness that as a healthcare professional, our plan might not go as scheduled because the patient might still have rights to decide what he or she wants. So it's always important to be mentally prepared to offer an alternative. Before the inquiry-based learning, I was wondering if we would work together as a team and come to an agreement and how we're going to operate throughout the module. But I have realized that teamwork is underpinned by communication, trust among members, shared goals, collaboration, diverse perspective, accountability, strong leadership skills, active listening, ability to foster continuous learning, which are all aspects of nursing practice. They are also crucial to manage a nursing team. I am confident that I have gained all these management skills as an individual. What was good in this inquiry-based learning was applying some leadership skills to coordinate care with my colleagues, which are being aware of my own values, applying evidence from research, commitment to bridge the gap of what is known or what might be known, and beliefs in leading effectively. When I was the chairperson, I operated as a transformational leader who shared information, encouraged critical thinking, understanding, motivated and inspired others, and I was open-minded. Researchers have found that transformational leaders can have a positive effect on the group. Some of these effects that I contributed are better performance. Those led by transformational individuals have better performance and are more satisfied than those in groups with different types of leaders. Better well-being. Team members who are led by transformational leaders tend to have better well-being and a sense of empowerment. This is attributed to the fact that transformational leaders believes that their followers can do the best, leading group members to feel inspired and empowered. When some colleagues did not communicate to the group and their reasons of not attending meetings, I managed to utilize my conflict resolution skills, which are completely ignoring the matter, and the ability to manage my own emotions and feelings and those of others. I also showed empathy when resolving interpersonal conflict in the group. My goal was to minimize the potential negative impact that can arise from disagreements and to increase the odds of positive outcome within the team. In practice, I have noticed that nurses do their task in time, but if they could not meet their deadlines, they would ask for help from another colleague to finish the task. And staff do not always agree to decisions, but they always offer safe care. Also, in practice, nurses are, if they are unsure or in doubt of the care they are going to deliver to the patient, they would go and ask one staff from the multidisciplinary team for assistance. We managed to seek advice from each other when we were not sure about the care we were delivering in the group. My experience with working with the team as well was, as at the beginning, some colleagues were keen to work collaboratively in groups because they had the experience, skills to work in teams, and some lacked the clarity of individual roles, leadership, and clinical accountability. However, towards the end of the team, everyone worked well, and we learned a lot from each other. We respected differences and shared responsibility, but we put the patient's needs first and advocated for them. Also, teamwork is important because it helps in clarifying roles. When everyone knew their role, it was easier for us to avoid any accidental overlap of responsibilities. It also improves communication skills. It promotes accountability, sets a good example to others, encourages adaptability. Teamwork can help prevent missed care, reduce errors, and also can increase motivation, confidence, and can create a healthy environment. As well as it also can encourage professional development and growth. Teamwork also encourages professional development because we learned from each other and gained a broader perspective on patients' care, and this environment of continuous learning enhances the quality of nursing practice. Effective teamwork often means that resources and other equipment are managed more efficiently, leading to cost savings and better system performance. One of the most fundamental aspects of nursing practice and health professionals more generally is teamwork. This is because teamwork is an essential ingredient for creating effective high-quality patient care and patient safety. It also plays a pivotal role in shaping the work environment, job satisfaction, and overall well-being of staff. We went through the Tuckman stages of development, which are knowing each other, trying to make good impression, which was a good time to create a set of shared expectations and guidelines. A team forming activity is also a good idea to build trust and get to know various strengths and limitations of the team members. This is an orientation stage on both an interpersonal and professional level, where boundaries and expectations are established. Storming differences arise, but we manage to resolve them, and collaboration grows. During the morning stage, if conflicts were resolved, during the morning stage, conflicts were resolved, and teammates proved flexible. All was going well, and team members knew their roles and worked on their task. And we also went through the performing and mourning stage, which helped us to establish relationships and mutual support. When we applied the nursing process to evaluate aliens' best interest meeting, I have realized that collaborative is underpinned by effective communication, our collaborative teamwork is also underpinned by effective communication, respect for individual differences, values, skills, task accomplishments of my colleagues. This is supported by the Nursing and Midwifery Council, that nurses should communicate effectively, respect shared knowledge and expertise with other members of the team, which is a fundamental aspect of nursing practice. I have discovered that as a healthcare professional, we have different background, cultural beliefs, experiences in managing patients with complex needs. Having exposure to different healthcare experience is an advantage because it helps in knowing services available to support patients, bridges the gap between theory and practice to achieve better health outcomes. Important competencies of team leaders are willingness to challenge poor collaboration, facilitative in their approach to encourage different contributions in the team, and awareness of interpersonal dynamics and being ready to be more directional when necessary. According to the cognitive continuum theory, relating intuition analysis to well-structured tasks in 6 interchangeable modes of inquiry has been applied in medicine to develop understanding and effectiveness of clinical judgment and decisions. We use the modes of inquiry in cognitive continuum theory, which include experimental research method, system-aided, peer-aided, and intuitive judgment, which collaboratively underpin a variety of diagnosis, prescriptive to evaluate clinical decision making during our Ellen's best interest meeting. We were aware that as nurses we have a professional responsibility to justify, explain, and defend judgments and decisions. So we worked as a team to defend and give each other chances to justify their own decisions. This is a reinforcement by the inclusion of judgment in 7-axis model for international classifications of nursing practice by allowing a holistic approach and judgment which used in making decisions based on assessment, the actions to be taken, and facilitated communication between healthcare professionals. This is also another NMC requirement to deliver care based on current evidence. Selecting most relevant evidence is required to make good clinical decisions. This is clinical understanding, reasoning, observations, evaluations, and across time through changes in the patient's conditions and concerns. We were able to take responsibility for our own mistakes when we made unjustified contributions. And we were able to take ownership if we made mistakes, and also we took accountability when we made mistakes towards clinical decisions. We followed guidelines, for example, NICE guidelines of involving Ellen in a best interest meeting, which ensures that she understands the risks, the benefits, and possible consequences of different options through discussion and information sharing. Shared decision making in healthcare is important because it empowers patients to actively participate in choices regarding their treatment. I also took accountability in acting as a role model in empowering others to grow, learn, and supporting my teammates. This is supported by the Nursing and Midwifery Council, that nurses should not only take full responsibility of their actions, but actions, omissions, and choices of their subordinates, because this maintains high standards of professional values and patient's care. We were all aware that accountability is our ethical, moral, and moral responsibility, as well as a legal obligation for all healthcare professionals. Accountability plays a pivotal role in improving patient outcomes and maintaining transparency, fosters culture of trust between care providers and service users and the wider public. When healthcare professionals embrace accountability, this ensures that safety, dignity, and trust of the masses who depend on them. We were all so aware that accountability is not just a principle, but a daily practice that protects both healthcare professionals and service users. The shared leadership theory emphasized the importance of distributed leadership, where team members share responsibility for decisions and accountability. Shared leadership theory posits that effective leadership is not solely the responsibility of one individual, but rather a collaborative effort where multiple team members share leadership functions and responsibility to achieve collective goals, sharing each other's unique skills and perspective to maximize team effectiveness. I would not have done this differently because we worked well. I will always respect other people's opinions, values, cultural beliefs in multidisciplinary meetings.